I'm Dr. Sanjay Addla. I'm a urologist, uro-oncologist, and a robotic surgeon working in Apollo Hospitals, Apollo Cancer Center, Jubilee Hills, Hyderabad. Today, we're going to talk about awareness of prostate cancer. Okay. Whenever we choose a topic, the first question would be, why do we need to bother about raising awareness? And the reason why we need to be bothered about it is the increasing incidence of prostate cancer in India. If you take the example from 1980s to now in 2022, where we have the latest data, in quite a few cities, the incidence of prostate cancer has almost tripled. Okay. So the incidence of prostate cancer in India is on the rise. That's one reason. The second is generally the symptoms associated with prostate cancer are very subtle. If somebody says that, oh, the symptoms are that you will notice blood in the urine or you will have bony pain, they are already very late. By the time we pick up a cancer with any of those symptoms, the bus has already left. We will only be managing to lengthen the patient's lifespan, but we can't cure him. Okay. So the only way to cure is to catch them when they are asymptomatic. So for patients to be aware that they are at a risk of developing prostate cancer makes them seek a screening test for prostate cancer. Thereby, we can pick up the cancer early, increasing the chances of cure. Why do we need to be doing? Take any cancer. When you look at a initial stage to a later stage, the treatment will be more expensive, associated with a higher side effect profile, and we might not be able to cure. The risk of recurrence is higher, and the overall treatment toxicity is also higher, both with respect to the side effects as well as the financial toxicity. So it is always good to pick up a cancer in the early stage, and nothing like a screen detected prostate cancer wherein the patient is asymptomatic. We pick up the cancer when it is still localized within the prostate, and that gives us the best chance of a cure. If you look at a typical example of prostate cancer, let's say in UK, developed society, you will be seeing around 30% of the cancers which have advanced or spread to the bones. The reverse is true in India. Almost 70% of the cancers in India are locally advanced or already metastatic. And that is the reason why we need to raise awareness so that we can pick up early and diagnose early, thereby increase the chances of a cure. The second element of it, why are we seeing more increased incidence of prostate cancer? The reason why we are seeing more and more of prostate cancer is a change in the lifestyle that we are seeing in India. If you look at the risk of prostate cancer in a Western society, it's almost around 1 in 7. Okay. It is far lower in India. But what we are seeing is we are seeing a lot more advanced, lot more aggressive prostate cancer in India. Okay. Now you might think, why are we seeing more often? The reason why we are seeing more often is there is a direct association between obesity, okay, and risk of prostate cancer. There is a higher probability of developing prostate cancer in a Western society. And the reason for that is the Western lifestyle. The more we adapt to Western lifestyle, the higher is the risk of prostate cancer. And that's why we are seeing more. And what is associated with a Western lifestyle? Having a higher calorie intake diet, having a more refined food calorie intake, having a high refined sugars, high in fat, high in processed meat. All these things are associated with a Western lifestyle, which is again a bit more sedentary in that you are gaining all the calories, but not spending them enough, thereby increasing the risk of prostate cancer. So that is the reason all the people in their 50s and 60s need to get their PSA check done so that we know whether there is any increased risk of prostate cancer, and then they can go on and get the investigations done. Now, the second talk of mine will be on diagnosis of prostate cancer. So let's say that you are very conscious, what I have told you has made a difference, and you go and get your PSA check done. And the PSA has been found to be elevated. So your PSA is higher, means there is a risk of you getting prostate cancer or having prostate cancer. If that is the case, Generally, the next step is you need to take a specialist opinion from a urologist who will examine you from your back passage. And generally, we tend to repeat the PSA. Following that will be an MRI scan of the prostate to see how does the prostate look. Is there any abnormality within the prostate? And if that is the case, then we tend to do a biopsy of the prostate. The biopsy of the prostate, we used to do them with finger guided. Then it came up to transrectal ultrasound scan guided. Currently, the most precise way of doing these biopsies is by what we call as a transperineal route, using again what we call as a real-time fusion. What that means is I look at an MRI scan, mark all the areas that are abnormal on the MRI scan, import those images into an ultrasound scan machine, and then target them through the perineum. What this does is it is giving me a better, accurate diagnosis. Second, the chance of missing cancer is less. And the third, the risk of infection is almost zero. So by doing a transperineal route and doing a real-time fusion biopsy, we are able to get these advantages. Once this step is done, once you're diagnosed with a prostate cancer, the next step we need to ask is how far has the cancer gone? Has it already gone to the bones or to the lymph nodes or elsewhere? And that one we tend to know by doing a staging investigation, which is commonly a gallium 68 PSMA PET. So it's a PET CT scan, but it's a specific one pertaining to prostate cancer that tells us where the cancer has gone. Once all these investigations are done, starting from a PSA, going up to a PET CT scan, we know whether someone has got a cancer or not. Second, what type of a cancer it is. Third, what is the volume of the cancer? Fourth, has it spread anywhere or not? Or even locally, is the whole prostate replaced with cancer? Has it gone to the seminal vesicles? Has it gone to the lymph nodes? All this information is gathered with investigations I've told you, and following that, a treatment pathway can be made, whether we can cure you of the cancer or not, or can we control the cancer? If so, what measures we need to put in place to control the cancer. So all these things are determined by following the pathway that I have told you, so that we can come up and say, oh, this gentleman has got a low risk prostate cancer, has got an intermediate risk prostate cancer, or a high risk, which is quite common in India. So once that is done, then the specialist could be a uro-oncologist or a urologist who will be able to offer you what actually is the treatment modality. Now comes the more important question. Rarely, let's say if somebody has got a stomach cancer, which is localized, there's only one option, which is surgery. Okay. Whereas for prostate cancer, why are there so many options of treating prostate cancer? Answering the question in a reverse way, what are the options of treating prostate cancer? Options of treating prostate cancer are generally threefold. One is just keeping an eye on the cancer, because not all prostate cancers are killer cancers, because of which we don't need to treat all the cancers. Okay. That's why there is an option called as an active surveillance, wherein we keep an eye on the cancer, or it's also called as a watchful wait, wherein we are looking for any symptom progression. The second option is in the form of radical prostatectomy, wherein we remove the prostate. Again, this can be done in three ways. Robotic technique, which is the standard way currently of doing it, open technique, or a laparoscopic technique. To what extent it is done, whether we remove the lymph nodes or not, what extent to the lymph nodes we remove, whether we remove the neurovascular bundles or not, again, to what extent we remove, these are all individualized to the patient. The next option is radiotherapy. Radiotherapy is given to the prostate or to the whole pelvis. And again, there are options in the form of whether we give it for 35 sessions, whether we give it for 20 sessions, or whether we give it for 5 or 6 sessions. So when you look at it, there are almost 7 or 8 different treatment pathways a person can go down the line of and still manage to get a cure from the cancer. The reason for that, putting it that way, was the number, whenever there is an option or when there are options of treating cancer, what that means is there isn't one way which has been proven to be the best way. These are all options because oncologically, cancer treatment wise, they are all the same. Okay. The second element of it, whenever we treat a cancer, especially prostate cancer, the problem is, if you remember, I started off saying that whenever we want to pick up a cancer early, it has to be early enough that the patient is not symptomatic. So when the patients are not symptomatic, whenever we treat the cancer, the minimum that we should get is, of course, cure from the cancer. The second is it should not have an impact on the quality of life of patient. So prostate cancer is a prime example wherein we have to look at the quantity of life as well as the quality of life. That's why all these options are there. The way I treat a 50-year-old gentleman who has got a low risk cancer is totally different to how I treat a 70-year-old gentleman who has got a low risk prostate cancer. The second, how important is his family life? How important is his sexual function to him? The third element, is he still going to father a child? All those things are important. And that's how you have to look at the patient as a holistic and then look at what are his emotional needs, what are his functional needs with respect to the continence and sexual function. And then the cancer treatment also comes in the way. If you remember, I said all the outcomes with respect to cancer are similar, whichever modality of treatment we go by. So if that is the case, what we need to find is what treatment fits in with this patient's disease to ensure cure. Second, we get a good quality of life. And the third, because of whatever social circumstances he is in India, there is a lot of travel that goes along with treatment for prostate cancer. That's a reason giving him a 5-session stereotactic radiotherapy probably might be better compared to somebody who is hailing from the same town, who can come every day, might receive 35 sessions. Though the efficacy is the same, how do we fit those things in depends on the financial status as well as the social status of the patient. Of course, taking into account the overall disease and what is the objective of treating it. Okay. So do get your prostate cancer screened for, in that in case if it is there, we pick it up early, improving the chance of cure, and then see a specialist who can go through all these options with you, walk you through all those options so that you can choose what is tailor made for you so that we can ensure cure of the cancer. Second, it has minimal impact on your quality of life. Thank you very much for your time.